Hello, my name is Peter Keast. I am a family nurse practitioner student at the University of Connecticut, and I'm going to be doing my midterm formative evaluation. This is Jen, one of our volunteers. Jen, do we have your permission to record this video for my training?
Yes.
Thank you very much. I'm going to do a quick room scan. My phone is a little bit low on battery, so I'm going to keep it at waist height, but I'll show you everything I got. Okay. Please excuse the mess. We are decorating for Halloween. Oh. So obviously in visiting with Jen, I will have checked her vital signs, performed appropriate hand hygiene, and read her chart and be familiar with her history. Jen, may I look at your skin?
Yeah.
Just breathe normal, be comfortable. There are no obvious rashes or deformity, there's no bruising over any of the joint surfaces. We have a tuberculin vaccine there, a BCG vaccine. She has a few freckly nevi on the chest. We know the Jen's of Celtic heritage. These are round, they're well defined. If we were looking for melanoma, we would be using the ABCDE approach. May I see your hands, please? Jen's hands are warm. Her skin is not dry, there's no rashes, there's no cracking. The turgor is very good. Hydrated, appropriate, no hypo or hyperpigmentation. Her nail beds are very nice. They are demonstrating no leukonychia, colonychia. There is no splinter hemorrhages, there's no Janeway lesions, no tarring, no staining. May I please see your feet, your toes? I'll hold your leg. Thank you. Just observing. No interweb space, rashes, no dryness or cracking. Nail bed is within normal limits. Same on this side. Turgor, pigmentation, all looking within normal limits. Thank you, Jen. Next thing I'm going to do is inspect your head. Is that okay? Do I have permission to touch your head?
Yeah.
Does it hurt when I touch you?
Not there, no.
Okay. So we're evaluating the skull, but also we're just having a quick look at the scalp. There's no nits, there's no dandruff, there's no dry scalp. The hair is fine. It's a little thin. It's well portioned. The hairline is intact. It's not dry. There's no eczematous borders or psoriatic borders. Hair looks great. You have lovely hair. Just going to continue inspecting your face. There's a subtle asymmetry with the left side being higher than the right. We know that Jen has a scoliosis of the cervical spine, so that's an expected finding. Okay. I'm just going to have a look in your ears. Is that okay if we move on to hearing? Now, for this test, actually, forgive me, if you can stay at 90 degrees, I'll have you close your eyes. I'm going to make little sounds on the left and right side of your body. And if you could take out your hearing aids, I'd be very grateful. So we don't want this to be a test. So just close your eyes. Tell me if it's left or right, please.
Left. Right. Right.
Okay, thank you. All right, now I would be very grateful if you turn to kitty corner so I can see your right ear, please. So we're inspecting it. The tragus, the auricle. Does it hurt back here on this bone?
No.
Okay. No mastoid tenderness. I'm going to get my otoscope. I'm going to have a look in your inner ear, okay? Or sorry, your middle ear and your outer ear. So there's no lesions, there's no rash, there's no obstructive features in the external auditory canal. I'm going to pull this back gently. I don't want to hurt you. Please tell me to stop if I do anything that is unpleasant. Okay, there's some subtle cerumen. The drum is present. It's full. It has a cone of light. The malleus and the incus are visible on that side. No rashes or anything up here. Thank you. There's soft cerumen in both ears. Cone of light is present on both of the eardrums. The bones are visible through the the drum itself, and there's no evidence of inflammation or anything abnormal within the ear canals. I'm just going to examine your face and your nose now. Is that okay? All right. Oh, actually, before I do, let's do that conductive hearing test that I heard so much about. I know we've done this a few times before. I know you know the rules.
Yeah, it's gone. Yeah, still hear it. Yeah, I can still hear it.
Good.
Yeah, it's gone. Still hear it. Yeah, it's gone. Still there.
All right. At this time, I'd like to take your glasses off. I'm going to examine your face by pressing gently. Does it hurt when I press here?
On the left, but it's normal for me.
Okay. Maxillary and mastoid sinuses. Jen has a lot of myofascial pain at baseline, plus allergies, and these things can be a little complex. But is it any different than normal?
No, it's absolutely normal for me.
Okay. I'm just going to have a look at your nose. The nose is symmetrical. There's no outward septal deviation. There's obviously no injuries or bruises. Just going to have a quick peek inside, if I might. Other side. Pink and moist mucosa, no polyps, no rash, no evidence of bleeding. The nares are intact. Everything looks good from the nose's point of view. Is your breathing through your nose okay? All right, I'll have a look in your mouth. If you could just open your mouth for me gently. Say ah.
Ah.
Lovely. You can close it to relax a moment. Uveal is midline. Tonsillar retinopathy on the left. Warm pink mucosa, no pus, no erythema. I'm going to look at your teeth. Just gently. Yeah, that's perfect. Just keep yourself comfortable. Okay, so the mucosa, the roof of the palate, and the dentition are in great condition. There's no caries. There is no discoloration within the mouth. There's no ulceration. There's no lichen planus. I'm just going to don some gloves. May I touch the inside of your mouth?
Mm-hmm.
Okay, open wide for me. This is the palate. So Jen has a narrow, high arch palate. Open wide for me, looking under the tongue. So sublingual mucosa, warm pink and well perfused. There's no obviously any Kaposi sarcoma, but neither is there induration or rash. The gums are not recessed. She has a molar on the top left third that has some unique recession, but there's no other gum recession. There's no gingival hyperplasia. There's nothing else going on inside the mouth that I am able to see at this time. I'm just going to examine your neck. Is that all right? I'm going to feel at the back ever so gently. Does it hurt when I do this?
Only in the way it normally does.
Midline tenderness, okay. Now I know you have lots of muscle pains. I'm just going to feel your shoulders, your trapezius muscles. Are these painful too?
Yeah.
Okay.
Again, it's really on the left-hand side that's really painful.
Okay, give me a neck stretch. Thank you. Okay. Sternocleidomastoids and scalenes are palpated. Tender, same distribution,
Yeah.
same way?
Mm-hmm.
Okay. I'm going to feel for lymph nodes. Postauricular, no nodes felt. Is it tender?
Only like normal. I'm sorry to keep repeating the same thing.
Preauricular, submandibular, submental. I don't feel any lymphadenopathy. Anterior superficial chain. Tonsillar adenopathy is actually noted on both sides. The left much more so than the right. When we were looking in the oropharynx, we saw the tonsils were larger. So we've got primary tonsillar lymph node on the left, but just the one. That chain is, we're going to do our deep lymph node chains. No nodes are felt. Posterior chains, no nodes are felt. Supra and infrascapular nodes are not appreciated. Sorry. You okay?
Mm-hmm.
Okay. Thank you for letting me palpate your neck. I'm just going to make sure that your trachea is midline. You can just keep looking straight, gently pressing on either side. The trachea is in the midline position. We'll do your thyroid check in just a moment, but let's do range of motion while we have the moment. So I'm not going to move Jen's head she has hypermobility. I have to be careful. So I'm going to have Jen, I'm going to give Jen commands. If you can turn your head to the left as far as you can comfortably, right? So we do have decreased range of motion. Jen can actually push it further, but she'll end up injuring herself because the bony and cartilaginous tissues will continue and the muscles and tendons will become very upset. Down towards your chest, and then back all the way, and then to neutral again. Is that okay? Okay, now we're going to do tilting to your left, and then to your right. Okay, and you can get it straight. That hurt, didn't it?
Yeah. Look,
I actually saw a hinge point right there on the right side of your neck when I was doing it. So you definitely have that hypermobility. We have to be ever so careful. Okay, as we're doing this, I'm going to now evaluate your thyroid gland. So let's do that 45 degrees. Make sure I'm palpating the cartilage, thyroid gland. Thank you. That's fine. No nodules, no goiter. If there was a large enlargement, we could listen for a thyroid bruit. We're not going to do that. Okay. Thank you very much. We've had a chance to look in your ears. We've looked at your neck. We've looked at your mouth. Right now we're going to examine your eyes. Is that okay? Mm-hmm. Okay. You can put your glasses on. We're going to do a vision test. Moving 6 feet away. Okay, cover your right eye with your right hand and tell me the lowest line of text you can read.
E-F-T-Z-O.
Okay, and now we're going to reverse it with the other eye.
C-F-D-H-J.
Okay. Right eye was 20/30, left eye is 20/25. Actually, reverse that, excuse me. Left eye is 20/30 and right eye is 20/25. We're now going to do this corrected, but also with both eyes. You don't have to cover your eyes.
L-T-F-P-H.
Yep, 20/20. Thank you very much. If we had a color test, we would do a vision check with that as well. Check her color vision. When I was doing her ear exam, failed to mention that if I had had a pressure tonometer that I could have been taking and measuring the pressures of the eardrum. Under those circumstances, I don't. You are welcome to put your hearing aids back in if you want.
Okay for now, because it's just you and me and my clothes.
Okay. For this, actually part of this exam, I'll have you take your glasses off, if that's okay. I'm just going to check your field of vision. Do you see any fingers?
Nope.
Okay, they're going to come slowly into your field of vision. Tell me when.
See the right, see the left, yeah.
Okay, that's excellent. Do you see any yet?
I see both now.
You see both now?
Mm-hmm.
Okay, that's excellent. I'm going to have you just stare at my nose. I'm going to shine a light in your eyes, okay? Mm-hmm. Good pupillary response. Good pupillary response. Now, Jen has a history of anisocoria, actually Holmes 80s, but so her left pupil is larger compared to the right.
Again, that's normal for me.
Yeah, normal for
I'm
Jen.
not the best person to do with this one.
No, it's not a problem. Right now, I just want you to look at my finger and follow it in the directions that it's going to go. Keep your head as still as you can. We're going to test our cranial nerves here. We're doing cranial nerve 3 and 4 and 6. We are looking for nystagmus. We're looking for lid lag. We're checking all 6 cardinal fields of vision. Did you see the finger in all those fields that you were tracking? Excellent. Just continue to watch the finger. It will approach you. It won't touch you. Okay, so we have excellent convergence and accommodation as well. I'm going to use the eye tool and I'm going to get quite close to you, okay? Let me get my ophthalmoscope. I'm going to go in this direction. I'm going to turn down the lights. 15 and 15. Red reflex, yeah. I'm cheating, I know. Red reflex is present in both eyes. Now I'm going to get quite close. I'd like you to continue just looking at that spot in the wall. Optic disc is present, retina is present, no hemorrhages within the macula. The macula itself looks good, the fovea is there, the cup looks normal, there's no evidence of papilledema. I'm going to approach closer again, sorry. Keep looking at that spot on the wall. The examination is symmetrical. The optic disc is not dilated. The retina is present. Macula appears to be within normal limits, as is the fovea. There's no evidence of hypertrophic changes within the eye. I appreciate your patience so far, Jen. Are you feeling okay? Okay, next thing we're going to do is just listen to your lungs, okay? Thank you for your patience. First thing we'll do is watch Jen breathe. Jen, just breathe normal. No distress, no extra auditory sounds, no wheeze, no stridor, neither upper nor airway. Chest expansion appears symmetrical in the anterior posterior view. I can check anterior, posterior, and lateral. Still appears to be normal. Do you feel comfortable breathing?
Mm-hmm.
Okay. I'm going to have you turn 45 degrees to your left. Then take a deep breath in with my hands equally. So Jen has equal expansion with our test. I'm just going to palpate the back of your body, okay? Does it hurt when I press on your paraspinal muscles?
Yeah, but again, it's
try to be really
for me.
tender. Okay. Just say 99 a few times for me.
99, 99, 99, 99, 99.
Okay. You can sit at 90 degrees forward, just facing me. Okay. I'm going to palpate your anterior chest. Is that okay?
Mm-hmm.
Is it tender again?
Yeah, but again, normal for me.
Okay. Thank you very much. What we're going to do is percuss, because I always forget to do that. So you can stay as you are. You've been very kind. I'm just going to percuss in our ladder pattern on the back. So we can demarcate the lower edges of the lungs. We got lovely resonant sound, no dullness. Jen, I'm just going to palpate the front, and then I'll do just under your armpits, and I'll need you to hold them aside. Oh, excuse me, let me try. I'm sorry.
It's okay.
Okay, lift this arm. Slither. Okay, resonant, lovely. Now have you take just some deep breaths in and out through your mouth. My diaphragm. Bronchovesicular clear. Just raise this arm. And down. Thank you. Lovely bronchovesicular breath sounds throughout. No crackles, no wheezes. Final thing is we'll do that soliloquy exercise that we did before. So we're going to start with 99. Go ahead.
99, 99, 99, 99, 99, 99,
Thank you.
99, 99, 99, 99.
That's fine, thank you. I just want you to say the letter E on an ongoing basis. Thank you, that's enough. That's perfect. So in utilizing these tests, we don't have any pectoriloquy, we don't have any ergophony. You've been very helpful, Jen. So what I'm going to do is move my equipment. I'm going to have you lay down in that 30-degree position that we did before. Okay. I'm going to give you a little bit more pillow support.
Yep.
Thanks. Okay, and
I'm gonna have to have this
Neck?
different. Yeah, I just can't
Sure.
have my neck in that position. Here, just put them underneath.
okay. Try that.
That's better.
Okay. We're going to look the sternomanubrial angle closest as we can to 30 degrees. We're going to look for the JVP. JVP is not appreciable. If we could see the JVP, what we would do is take a measurement from the sternomanubrial angle at 90 degrees, and then we would know within the realm of what was in reason. I'm just going to feel your pulse in your neck now, Jen. Is that okay? Okay. She has a good carotid pulse. There's no thrill. There's no bruise. Just gonna have a quick listen to your neck. You're doing well. Just breathe normal. No carotid bruise or hurt. No referring thrills. What I'm going to do, Jen, next is I'm going to palpate your chest gently, and I'm going to look for the point of maximal impulse. Is that okay? So, gently pressing. I know that you have costochondral tenderness, so please excuse me. I'm just going to feel. Start actually on the right. No heaves. No pulsations, no thrills. Obviously, in inspecting the chest, we would be looking for heaves and thrills and paradoxical movements with heartbeat as opposed to breathing. May I have permission to touch just the side of your breast on the left side? Thank you. You're feeling for the point of maximal impulse, a little harder on women with larger breasts, but that is okay. So we do feel it in the mid-axillary line, and it's about the size of a dime, and it's between the 5th and 6th intercostal space on that side. So that is a good thing. The next thing I'm going to do, we've done inspection, palpation. We're going to percuss, well, we could percuss out the borders of the heart if it was determined that we couldn't find the PMI, but since we did find the PMI, we don't have to do that. We're now going to have a listen to your heart sounds. Is that okay, Jen?
Yeah, I'm just gonna have to support my lower back then.
Of course.
Sorry.
Take your time. No, it's quite all right.
Sorry.
Do you need a pill?
No, it's just I had a muscle spasm.
Tell me when you're ready for me to proceed. It's
I'm
okay.
ready.
Okay. Just listening with my diaphragm first. I'm going to listen just to the left of your breast, okay?
Mm-hmm.
With the diaphragm of my stethoscope, I can hear an S1, S2. There's no splits, there are no clicks. We will evaluate for an S3 and 4. What I'm going to do just at the moment, Jen, is listen with my bell. There's no additional findings with the bell. Jenna, in a little bit, can I have you just turn about 45 to 90 degrees to your left? And I'm just going to listen to your heartbeat as it lays against your ribs in that position. Okay, so just arms down. That's fine. And over a smidge. Thank you. Thank you. That's all I need. Yep. For the final part of our exam, I do need you to slowly sit up, and I'll have you lean forward a smidge, okay? In the left lateral decubitus position, there was no S3 or 4. Now just leaning forward about as much as 10 to 20 degrees comfortably, okay? I'm just going to listen again over the front. All right. That concludes our exam, Jen. Thank you very much for your time.